Discover revolutionary laser treatments for athletes' tonsil issues and rapid recovery.
One thing I'm highly passionate about are minimally invasive procedures to manage chronic conditions, that, don't interfere with people's lifestyle. And a big thing that people are concerned about, obviously, if they have chronic tonsil problems, whether it be with tonsil stones or with chronic infections or with size of their tonsils. And tonsillectomy is a procedure that will, take you out of work and activities for a week and a half or so. And it's, a relatively, you know, interrupting procedure to have done. It's safe, it's commonly done, etc., but it's still invasive. So for adults who have problems with chronic tonsil pockets and bad breath and cheesy stuff, or even some with recurring infections, and certainly people with large tonsils, if that needs to be reduced, I can do that in the office now with laser. So I'll use the laser to shrink those tissues just using some little bit of local anesthesia. The patient just drives in and drives out of the office. One treatment is usually all that's necessary, and I can need about 80% of the tonsillar tissue with one treatment in the office. They have a moderate sore throat, but they can go back to normal activities. I had a patient who I saw recently, a D1 football player, and came in from out of town. They had problems where they were having sleep apnea issues, as well as chronic tonsillar issues due to their tonsils. I mean, this is an athlete. This is not someone who is having problems with their weight or things of that nature. And in the office, I was able to, ablate most of their tonsil on a Friday. They were back at practice on Monday, and they competed in a game on Wednesday. And this is someone who had their tonsils taken. The patient's mother said that he slept without snoring for the first time since he was a teenager. And that was just a few days after the procedure. So that's very rewarding to me to be able to do that for patients in a minimally invasive way that, was not available before.